Thank you all for joining. Today's workshop is new to Medicare, understanding Medicare and its components. I'm Jolene with the AMAC Foundation. We appreciate you finding us and joining us today. AMAC Foundation is here to support and educate America's seniors. We work across the board with all issues, Social Security. We do events, seminars, webinars. We have Medicare, both in on the Social Security front, but we have guest presenter today, Deanna Cameron with the AMAC Medicare Division. If you're an AMAC member, you may be familiar with that member benefit. AMAC Foundation serves both members and non-members. You do not have to be a member to join in, use our resources, or attend any of our events. And I'm going to give this over to Deanna. If you have any questions, you could put them in the Q&A and we'll try to answer them as best as possible during the presentation, but we'll leave a few minutes at the end as well. Thank you. Go ahead, Deanna.
Well, thanks, Jolene. I appreciate that. As we've done in the past, I usually start just by a quick introduction. My name is Deanna Cameron. I am a licensed agent here in the AMAC Senior Resources Division, specifically Medicare. And the way our assistance works is similar to the foundation. We don't require people to be paid members of AMAC in order to work with us. We'd love to have you, of course, but we're happy to assist you with your Medicare needs, whether or not you're a member. And in fact, me as an agent, I don't pay much attention to that. We're happy to help either way. So I would like to try to keep this interactive if we can. We can see questions. Jolene will help manage the questions as they come in, if I don't see all of them. So, feel free to type in your questions and we can take the opportunity to answer them as we go along. If you're more comfortable listening to everything and asking questions at the end, that's okay too. We're pretty flexible here. So today we are going to dive into Medicare and its components. There are a team of about 35 agents in our 3 call centers helping members and non-members with their Medicare needs. Our call centers are located in Long Island on New York, or New York on Long Island, excuse me, in Central Florida, which is where I'm located. And then we have a call center also in Albuquerque, New Mexico. So we do a pretty good job of covering all time zones in the US so that we're available to answer most everybody's questions. So the presentation that we're going over today is sort of an expanded version of the information that we go over with our customers on the phone for those who aren't as well versed in Medicare. Medicare is very complex. We know that. We're trained very well over quite a long period of time, and we don't expect the average person to take that kind of time to learn about Medicare. So that's why we're happy to provide these kinds of workshops. So we want to be sure that you're educated so that you can make educated choices, researched choices in your Medicare options. So the first thing I'd like to start out with is, what is Medicare? What are your options with Medicare? And what makes you eligible for it? So these are the information that we're going over is based on the kinds of questions that we get from members when they call us. And the answers that we can provide as they become eligible for Medicare. There's typically 4 different reasons that you would become eligible. The first and most common is you turn age 65. That is the age that you do become eligible for Medicare. But there are other ways to become eligible. If you're on Social Security disability, you become eligible for Medicare on the 25th month of receiving those benefits. So basically after 2 years on disability. Other ways that you can become Medicare eligible is on the 4th month of receiving dialysis for end-stage renal disease. And you can also become eligible for Medicare if you're diagnosed with ALS, which is Lou Gehrig's disease. So any of these other circumstances aside from turning 65 can make you eligible for Medicare. So what exactly is Medicare? Sure, you hear, the alphabet soup, and it's very confusing. So let's drill down to just exactly what Medicare is here. So it comes in 4 parts to you. We're going to talk about the first 2 parts to begin with. This is what we refer to as Part A and Part B of Medicare, or Original Medicare. These parts are not provided to you by any kind of an agent. They're provided through Social Security if you're eligible. So starting with Part A, this is your hospital insurance. Typically, there's not going to be any kind of premium for your Part A if you've paid through payroll deductions over at least 10 years of working, 40 quarters. Most of us meet that criteria, so your Part A is covered. So it's not technically free, but you've paid into it, and you don't have to worry about any additional premium on that. If you have any questions about whether or not you've worked enough quarters, or if you haven't worked, but perhaps your spouse has worked, you can certainly reach out to Social Security to determine, whether or not you owe any kind of premium for that. And chances are probably you not. So as far as Part A coverage goes, it's going to help with hospital information, hospital services, and this includes inpatient hospital stays, stays with a skilled nursing facility, and hospice care if you're ever in need of hospice. The other side of Medicare is Part B, and this is your medical coverage. This part of Medicare is typically going to come with a premium. Now, the base premium currently is set at $164.90 per month. They haven't published the new rates for 2024 yet, or if they are published, I have not seen them, but it's likely that this would be adjusted up a bit. Now, you can pay a higher premium if you have a higher than average income. So right now, based on income from the last full tax year, or 2021, if you as a single individual make more than $97,000, excuse me, or filing jointly as a couple make more than $194,000, anything higher than that, then they are going to adjust up your Part B premium. So as far as the services of Part B, these are going to cover your Medicare approved doctor services, lab testing, your MRIs, CAT scans, and things like durable medical equipment. So like I said earlier, both of these parts of Medicare are required through Social Security. It's not through an agent. Now, the other 2 parts of Medicare are the Part C and the Part D. These parts do require that you sign up either through an agent, directly with a carrier, or through a website like Medicare.gov. Part C are also known as Advantage plans, Medicare Advantage plans. So let me discuss just briefly here what these can do for you. Now, these types of plans may operate very much like what you have had from an employer coverage. They're network plans, typically either HMOs or PPOs. And how these work is that private carriers have contracts with Medicare to provide your Medicare services through that provider's plan. So in other words, your Part A and Part B of Medicare, which you do have to have in order to be eligible for the Advantage plan, is now being covered by the Advantage plan that you choose, or the Part C plan that you choose, and all of their terms and conditions. So they're replacing your Medicare for the calendar year, and barring any kind of special circumstances, you are obligated to that contractual plan until December 31st of that year. So that's an important thing to keep in mind, how an Advantage plan will cover your Medicare, take over the coverage, and be the plan that is covering you for that contractual year. Now, the last part of the alphabet soup, so to speak, of Medicare is Part D. And I like to think of this as Part D for drug. So this is your standalone prescription drug coverage. And just like with the Advantage plans, these plans are available through private carriers. So you can sign up for Part D through an agent or straight through Medicare or directly with one of those carriers. And like the Advantage plans, the Part D plans are contractual for a calendar year. Now, the Part D plans are intended to work for those who are staying on original Medicare Part A and Part B. You can't take a standalone prescription drug plan if you're enrolled into a Part C Advantage plan. Advantage plans typically cover prescription drugs, or you forego that coverage if you prefer. And we'll talk a little bit more about that later. So it's important to remember that your Part A hospital and your Part B medical do not provide any kind of coverage for prescription medications. That's why you seek it out with these additional options. So just to recap on this, Part A is your hospital, Part B is your medical. You can replace both of these with a Part C Advantage plan, or you can stay on Part A and Part B and potentially get a standalone prescription drug plan or Part D to cover your prescription medication needs. I don't see any questions here. I don't know if anybody wants to chime in with anything. Sorry about that. It's a little hard to move just one square at a time, one screen at a time. So my apologies if I gave anybody a little seasickness there. All right. So question, even though I'm eligible for Medicare, do I have to take it? We get a lot of calls from people like, I'm turning 65, I'm getting a lot of material in the mail. Do I have to take Medicare? I'm still working. I have an employer coverage. So that's really the first question as you approach your 65th birthday. In general, the answer may be no. You don't have to take Medicare if you have creditable coverage, such as an employer or group plan in place. You can delay your participating in Medicare without any type of penalty, provided the, the you are working and the coverage that you have is creditable. Now, I always recommend people ask their HR department, does our employer coverage here suffice, or is it creditable in place of Medicare? That way you know for sure. In general, if you have a large employer, more than 20 people, they are required to have creditable coverage. But if you work for a smaller employer, that may not be the case. So with that creditable coverage in place, you can delay participating in Medicare and not face any penalty. Just want to remember that you do have to have that creditable coverage in place and continue to be working. If you retire and your employer has a retirement package, you most likely will still need to enroll into Part B because retirement packages do not qualify as being creditable in place of Part B. So just keep that in mind. And that's always a good question to call and ask our agents about. I'm thinking of retiring, but my employer has a retirement plan. Do I have to enroll in Medicare? In most cases, yes, you would if you will no longer be working. But again, give us a call. We can go through your scenario and make sure that that is accurate information. So, because your Part A for most people comes without any kind of a premium and you have creditable coverage, you can go ahead and enroll in your Part A. It in combination with your employer coverage may take care of all of your out-of-pocket costs for hospitalization. So it's not a bad idea to go ahead and take it if you've paid into it and you don't have any kind of a premium. It can be there to kind of be a backup to your employer coverage. I do see a question here. What happens if you didn't enroll at 65 and are about to turn 66? Well, if you have no coverage in place, then they will likely impose a penalty for that 12-month period that you were eligible for Medicare and did not take it. You may also not be able to enroll into Medicare until the general enrollment period, which is January 1st through the end of March each year. If you don't have a special circumstance like ending employer coverage within the last 2 months, then you may have to wait until that general enrollment period to take your Medicare. It's a great question. We get it all the time. So um, the penalty is calculated for each 12-month period based on 1% of the um, the Part B premium for that year, I believe is how it's calculated. Medicare will be able to tell you what your penalty will be, and that just gets added on to that premium for your Part B. All right. So we talked about participating in Part A, even if you are still in your employer coverage. Um, and delaying your Part B. Now, as long as your employer coverage is creditable and includes prescription drug coverage, then you're not facing any penalties for delaying that coverage. It's important to realize now, Part B of Medicare and Part D, even though they can come with penalties for delaying them, they are considered voluntary. But you just want to keep in mind that if you don't maintain the coverages in the way that the government stipulates, then you can face those penalties, like I said. So when do I sign up for Medicare? When you're first eligible for Medicare, Social Security provides you with a 7-month window where you can sign up, decide whether or not you want to sign up and begin your coverage. So the 7 months begins 3 months prior to your month of eligibility, whether that is turning 65 or that 4th month of being on end-stage renal disease. You have 3 months prior to the eligibility month, the month of eligibility, and then 3 months after the month of eligibility to enroll. During that time, you that's your opportunity to make a decision. You're not going to incur any penalties during that time. Anything that you might delay is not going to start those penalties until that 7-month period is exhausted. So if you're turning 65 and your plan is to enroll into Medicare when you're first eligible, then contacting Social Security 3 months prior to the month that you turn 65 is not too early. 6 months before is too early. But if you call them within 3 months, then they'll be prepared to get you enrolled into Medicare for a start, typically on the first of the month that you turn 65. Now, if your birthday is on the first of the month, then your Medicare actually starts a month earlier. So just keep that in mind. Sometimes people don't realize that and they've lost a month of eligibility. Not that that's usually a big deal, but sometimes people are surprised, like, oh, well, I have an April birthday, but my my start date for Medicare is March 1st, and it turns out they're an April Fool's baby. So they started in March. So, like I mentioned, you will contact Social Security to start your Medicare. Now, if you're already on Social Security benefits prior to turning 65, Social Security will take the initiative to enroll you into Medicare 3 to 4 months prior to your 65th birthday. You'll receive something in the mail, and this is indicating that your Part A and Part B are starting on the month you turn 65 or the month you become eligible if you're earlier than 65. It's up to you to let Social Security know if you don't want to participate in Medicare that early. In fact, they have very clear instructions in what they send you to cross off the Part B and return the card to them. They'll reissue your card with just your Part A in place, typically because that's coming to you without a premium, and you'll get your card with just your Part A in a few weeks. So, your premium for Part B, if you're collecting Social Security, will then be deducted from your Social Security benefit starting the month of your Medicare. If you're not receiving Social Security benefits and you've contacted Social Security, they enroll you into Medicare, you will be billed the Part B premium on a quarterly basis. So just be prepared for that. Whatever your monthly premium is, obviously, going to be multiplied by 3. You'll get it quarterly and need to pay it that way. All right. So as far as your Medicare options go, um, the first option, of course, is that you can just participate in Original Medicare. That is, have the Part A hospital coverage and the Part B medical coverage. It's important to know, though, that there are out-of-pocket costs associated with having just the Part A and Part B. Medicare was not ever designed to pay 100%. And so there are going to be costs that you're exposed to with just the Part A and the Part B as your insurance. Just to go over some of these. If you are hospitalized, currently there is an inpatient hospital deductible at $1,600. This is money you pay up front before the insurance starts to cover you. So inpatient in the hospital with just Medicare Part A covering you, you'll have a $1,600 deductible off the top. And this is going to cover you for the first 60 days in the hospital, room and board, just room and board. So if you have doctors that see you, some doctor services, maybe certain imaging services, things like that, could be billed under your Part B. So you got to keep that in mind, and we'll talk about how that would be out of pocket in just a moment. If you had the misfortune of being in the hospital beyond 60 days, you can start to incur a copay, a daily copay. So from days 61 through 90, your copay per day is $400. And then for days 91 through 150, that doubles to a copay of $180 per day. Now, Medicare itself, Part A, only covers you for 150 total days in a lifetime in the hospital. So that's important to keep in mind. There is a limit. After you've used 150 total days over the lifetime in a hospital, then you're responsible for 100% of the hospital costs if you're just on Part A of Medicare. Now, the skilled nursing facilities are also billed under Part A. Like I said earlier, not to confuse these with like a nursing home. Skilled nursing facilities are basically your rehabs or step downs from the hospital. It's more for physical therapy. And Medicare will cover the first 20 days in a skilled nursing facility at no cost to you. I believe Medicare requires that you come out of a hospital before you go into skilled nursing. It's sort of a direct transfer. So you're already paying, or you've already paid that deductible in those first 20 days or previous to the first 20 days because you've been hospitalized. So you get a bit of a break going into a skilled nursing facility in that you're not seeing any additional out-of-pocket costs for your stay in those first 20 days. However, days 21 through 100, you then are back to having a daily copay of $200 per day. Skilled nursing facilities will cover you for 100 days per benefit period. It's not a lifetime amount, it's basically per incident. But after those 100 days per incident, you are responsible for 100% of those costs. So for Part B, this is your medical side. So at the current rates, Medicare Part B has a deductible of $226. It's an annual deductible, very traditional annual deductible, what we are used to seeing. So this has to be met, and once you've met that deductible, you then have a shared co-insurance with Medicare, in which they'll pick up 80% of the costs, and you'll be responsible for 20%. Now, there are some exceptions. Some lab work and preventive services are usually covered at 100% by Medicare if they meet their criteria. And there's also something called Medicare excess charges. Now, what these are a small percentage of doctors do not accept the Medicare reimbursement amount, and they have the right to charge an additional 15% above that amount to balance bill and make up the difference. So you would be exposed to that cost in the rare occasion that you see a doctor that requires those costs. It's literally under the 10% of doctors in the country that charge excess charges. So like I said, it is quite rare, but definitely worth mentioning because 15% can add up for sure. So just a couple of things about staying with the Medicare Part A and Part B is you'll have no network. So unlike the Advantage plans that have HMOs and PPO networks, if you decide to stay on Original Medicare, you can go anywhere in the US or US territories to any provider that accepts Medicare. Remember though, prescriptions are not covered. Your prescription medications are not going to be covered by Part A and Part B. So for those people who stay with the coverage of Original Medicare Part A and Part B, they'll generally look to participate in a separate Part D plan. Remember, Part D for drug. And this would be an additional premium to cover those prescription needs. One of the negative aspects of staying with Original Medicare, just being covered by the Part A and the Part B, is it doesn't have a maximum out of pocket. Now, what this means is that there's no ceiling on how much you can be billed. Every dime you owe is owed beyond what Medicare will cover, no matter how high that turns out to be. So one of the options that many beneficiaries really like is that they can add secondary insurance to the Part A and the Part B. This is what we call a Medigap or Medicare supplement plan. This again is going to be an additional premium, but it's going to help cover those costs that Medicare is leaving behind for you. Please know there are multiple plan options, and how much is covered is completely dependent on how or what plan you choose to enroll into. Each of these types of plans have different coverages. The plans are usually labeled with a letter just to complicate things and make the alphabet soup a little richer. And whichever letter designator comes with it, such as a Plan G, the core benefits are standardized and identical, no matter what carrier you choose to purchase that Plan G from. So just to give you an example, here at AMAT, we license with approximately 10 different supplement carriers or Medigap carriers. And what we attempt to look for when you call us and say you're looking for a Plan G supplement is looking for the least amount of premium, the lowest premium amount for the coverage that you are seeking. So you'll still have to pay your Part B premium to Social Security, that $164.90, and then your supplement, because it's secondary to Part A and Part B, would be an additional premium and would pay after Part A and Part B. Now you can apply for your supplement or Medigap plans anytime that you're on original Medicare and you don't have any other type of coverage in place. But the first 6 months of being on Medicare Part B is a very important time period. This is called your open enrollment. And during your open enrollment, you're allowed to apply for any supplement plan without medical underwriting. It means they have to accept you without asking you any medical questions and without assessing your risk or your height and weight or any of those. Outside of that open enrollment period, beyond that 6 months on your Part B, they can assess those risks and can decide to either accept or decline you based on your health and how risky they believe taking you on as a client would be. But like I said, they're not allowed to do that if you're within your first 6 months of Medicare Part B. So that's why that's such an important period. Now, there are 10 different Medicare supplement plans that you can choose from. Not all of these plans are sold competitively. So it's also important to know that you can't combine your supplement plan with other coverage like an Advantage plan. They work differently. One's replacing your Part A and Part B, the other's supplementing it. So you choose one type of coverage over the other. All right. So here's a chart showing the different Medicare supplements. And don't worry, we're not going to talk too much about all of them. There's basically 3 to 5 of them that are most common, most competitively priced, and that's what we're going to focus on. First off, we're going to talk a little bit about the Plan F, which you'll see kind of down the middle of the chart. You're going to see that all the green check marks are checked off under Plan F. And then from there, we're also going to talk about the plan right next door, the Plan G, and then we're going to go all the way to the end with the Plan N. Okay, these are the plans that are most comprehensive and most competitively priced. So looking back at that Plan F, this is the most comprehensive coverage that's available as far as Medicare supplements or Medigap plans go. It's going to pick up 100% of those gaps in coverage that Medicare leaves behind. So you pay your premiums and you really shouldn't have any additional bills for Medicare covered services. It does add a few things that Medicare doesn't cover. So if you look over at the left-hand column at all the line items of coverage, you'll see everything that is covered under the Plan F or any of these plans. And this includes all of your co-insurance and hospital costs, including an additional 365 days in the hospital beyond what Medicare covers. Remember, we talked earlier that Medicare covers only 150 days lifetime in the hospital. Well, Medicare supplement's going to add another year to that. If you take a supplement like a Plan F, The supplement will pick up the 20% of the Part B coinsurances that are left behind by Medicare. It's going to cover the first 3 pints of blood that Medicare does not cover. That's sort of the typing and in the first transfusion that you might need. It's going to pay for your Part A hospice care coinsurance, your skilled nursing facility coinsurance, and it's going to cover both your Part A and your Part B deductibles. And lastly, on those green check marks, you'll see that it is covering any Part B excess charges. We mentioned those small percentage of doctors that don't accept what Medicare will reimburse them at. Your Plan F is going to pick up those excess charges if you encounter any of those providers. The plans do have some limits. If you find yourself outside of the United States, you do have emergency coverage for the first 60 days of your travel, and it will cover 80%. There is a $250 deductible with that coverage, but it's nice to know that 80% of that coverage would be taken care of up to a lifetime limit of $50,000. Now remember, the supplement is not going to add the prescription drug coverage, and it's not coming from your prescription drug coverage is not coming from Part A or Part B. So in these scenarios where people are keeping Medicare and taking a supplement, they will usually look to add that Part D coverage in addition, so that they have prescription coverage, avoid a future penalty, and have coverage for the medications that you're taking. I do want to jump over and talk just a little bit about Plan G. This is quickly becoming the most common Medicare supplement, and it's almost identical to the Plan F. The only difference is that it is not covering the Part B deductible, that small $226 annual deductible that you would be responsible for out of pocket with a Plan G. And that's the only difference between a Plan G and a Plan F. Now, the government back in 2020 sort of took Plan F off the table for anyone aging in and becoming eligible for Medicare starting after January 1st of 2020. So the macro law that was put in place there, sorry about that, requires that all new Medicare enrollees contribute at least that Part B deductible towards their care. So those folks cannot purchase the Plan F or the Plan C for that matter. Not that many are looking at the Plan C, but it is off the table for the younger enrollees. But the Plan G can be a good alternative for that, and so one that we often talk about with our customers. All right, got a little off here on my script, so bear with me. So both Plan F and Plan G also offer what are called high deductible options. Now, the plans work exactly the same, but they don't start to work for you until you meet a quote unquote high deductible. Now, that deductible amount for this year is set at $2,700. In today's market, I don't believe that's too high of a deductible, especially when I'm hearing people saying they have a $5,000 or $7,000 or $10,000 deductible. But these types of plans can be a really good option because the premiums are much less. And so your monthly out of pocket to have the coverage, you can save a lot of money there. I do also like to look as well at the Plan N. I mentioned this earlier. The Plan N, again, is very similar to the Plan F and the Plan G. You do still have that deductible, the first $226 of your Part B services, your doctor services, et cetera. It's not going to cover excess charges. So that's another difference. Um, so in the rare case that you have a plan N and you encounter a provider that does not accept what Medicare will reimburse them at, you may see up to 15% excess charge. However, there are a handful of states that don't allow excess charges. They are Connecticut, Massachusetts, Minnesota, Pennsylvania, Rhode Island, Vermont. New York only allows up to a 5% excess charge. So they almost don't allow excess charges, but they do allow up to 5%. So the Plan N can be a really economical choice in the states that don't allow that excess charge because the premiums are typically quite a bit of savings under the Plan G. So I always like to mention that and look at that for my customers. If they don't mind the copays, then it can be a good option. So that's the only other difference. With a Plan N, when you go to the doctors, you could have a copay of $20. And if you go to the ER, you could have a copay of $50 if you're not immediately admitted to the hospital. That with the deductible is really the only difference in the Plan N. So those are the three plans that we mostly talk about here at AMAC. The other plans are not widely sold. They're lesser coverage in most cases. And because the carriers don't want to have to kind of keep all of these different plans on their books, they're typically they're not competitively priced. You're sort of discouraged from buying them. So we're always happy to quote them if we have them, but what we usually find is like, oh, you wanted to look at the Plan K at 50% coverage. It's as much as a Plan N or as much as a Plan G. So there isn't enough savings to make it, worth it, basically. All right, so we've talked about the supplements. I don't see any questions up. I don't know if anyone wants to bring up a question before we dive into the other option. So the next option for how you can add to your Medicare coverage is purchasing or enrolling into a Medicare Part C plan, also known as a Medicare Advantage. So in this case, then you are agreeing to have a private carrier cover your Medicare needs for the calendar year. Now, in other words, instead of the prices that we just talked about for Part A and Part B deductibles and 20% coinsurance, with an Advantage plan, you're agreeing to pay the terms and conditions from that private carrier. And they can all be very different. Medicare Advantage plans will generally have a much lower premium than your Medicare supplement plans, but there's still going to be costs associated from the services that you receive. So, for example, you may have to pay a copay to see a primary care physician or a specialist. If you're hospitalized, you may have a copay between $100 to $300 per day for the first 5, 6, 7 days that you're in the hospital. You may have a copay of $75 for an x-ray. Now, these are just examples, but it kind of gives you an idea that even though you're not paying on Medicare's terms and conditions, you're paying on the plan itself's terms and conditions. And in some cases, you may find you pay more than if you had stayed on Medicare. And sometimes you may find that your service costs less than if you had stayed on Medicare. Important to realize, though, that if Medicare provides a service for hospital or medical needs, if it's covered by Medicare, then the Advantage plan must by law also provide that service. It's just that it can cost different. Your charges are different. So as I mentioned before, the premiums for the Advantage plans are generally much lower and often are as low as a $0 premium. So it's not unusual to find a plan that won't cost you anything additional besides what you're paying for Medicare. You see the ads on TV all the time. They like to use the word free. I don't like to use the word free because it's not free, as you can see. You're going to have out-of-pocket costs. But that premium can be as low as $0, and some people definitely like that aspect. So remember, with these plans, you are still paying your Medicare premium for Part B. If you do have a premium for Part A, you do have to pay that as well because you have to have Part A and B in place covering you. When you're paying your Medicare Part B premium, that $164.90, when you have an Advantage plan, that money is being diverted to the private carrier in because you've enrolled into that Advantage plan. So they're getting paid because you've enrolled into the plan. Even if you never go to the doctor or you're never hospitalized, that plan is still benefiting from the fact that you've enrolled. So a lot of times people will ask that, well, how the heck can I have, medical benefits at a $0 premium? And that's the answer. They're getting some of your Part B premium. So they're happy to take that money, whether you ever see a doctor and then any copays that you might pay. And that's how they make their money on those. So Advantage plans offer some additional benefits, which can be a really nice part of having an Advantage plan, things that Medicare doesn't cover. So in general, Medicare doesn't cover routine vision, dental, or hearing, but many of the Advantage plans will generally offer these additional benefits that Medicare is not taking care of. Now, Medicare will cover medical necessities for dental, vision, and hearing. Like if you get in a car accident and you get some teeth knocked out or you break your jaw, Medicare is going to cover these because it's medically necessary. But things like teeth cleanings, cavities, bridge work, these are not generally going to be covered under Medicare itself. But with an Advantage plan, you might have additional coverage towards these types of comprehensive dental services that are not normally handled by Medicare. Another nice thing about the Advantage plans, I do see a quick question here. Will Medicare cover cataract surgery? And the answer is yes. Cataracts are considered a medical condition of the eye. And it is covered by Medicare. With an Advantage plan, it's typically going to be an outpatient surgery type of coverage. So that's where you would look in your plan as to what your out of pocket would be. Now, if you're on Medicare Part A and Part B, it's going to be covered under Part B at 80%. And if you have a supplement that's picking up the other 20, then it might be covered, completely, or you might just have that $226 deductible. But yes, cataracts are a medical condition of the eye, not something covered under your vision. All right. So, couple of other nice things about the Advantage plans is that they generally have wellness coverage. This is getting to be more and more prevalent, that wellness coverage. I do see the question. I will get to answering that. So you may have heard of things like Silver Sneakers or Silver and Fit. These are programs that allow you free memberships to some of your local fitness facilities. And the Advantage plans usually add that type of a benefit. It may say Silver Sneakers, it may say Silver and Fit. As an agent working with you to look at the coverages of an Advantage plan, you can ask those questions. Is Silver Sneakers included? I even keep a bookmark on my computer to both Silver Sneakers and Silver and Fit, to let them know, if their particular health, health and fitness facility is included in the coverage. Just to say, oh, look, you like to go to the Y in downtown Miami, that is covered by this plan. So that is definitely one of the added perks. The Advantage plans are usually going to include prescription drug coverage within the benefits that they're offering. So you wouldn't have to purchase an additional Part D plan, standalone drug plan. In fact, you cannot have both an Advantage plan and a standalone prescription drug plan in most cases. So one of the things that we look at is how would an Advantage plan cover your particular medications? Make sure it's going to be cost effective for you. And that can be nice. The standalone prescription drug plans are always going to have some kind of a premium. Sometimes it's quite low. But if you find an Advantage plan at a $0 premium and you take, very inexpensive generic medications that are a $0 copay, then you've gotten your prescriptions covered with no additional out of pocket. And I see that all the time. One important thing that the Advantage plans do have, as I mentioned, where Medicare does not have, is that they all set a maximum out of pocket. And what this means is that your out of pocket, your out of pocket expenses with copays and coinsurance for your medical care, not your vision, dental, or hearing, not your prescription meds, but simply your medical care. If they reach that maximum out of pocket, then the plan is going to pick up 100% for the remainder of that year. Not a deductible. You're still getting coverage before you hit that point, but it's sort of the ceiling on your wallet so that you're not going to go above that amount out of your pocket for that year because the plan sets that maximum. I hope that's clear to people. It's one sometimes that we have a hard time explaining and having people understand. All right. So just as an example right now, and these, I'm not sure that this figure is exactly right, but you may have a maximum out of pocket anywhere from about $7,000 to $11,000. Now, a lot of the plans are going to set them lower than that. Those are the maximum that Medicare will allow. So that's an important piece to consider when you're looking at the Advantage plans is, how much could I potentially pay out of pocket if, I had a very bad year health-wise. All right. So there's a question about the 5-star rating. So all Medicare Advantage plans and prescription drug plans are rated by Medicare's 5-star rating system. And this can be an important part of shopping. Now, here at AMAC, we typically are only going to be looking at plans that have a 3-star rating or higher, 3, 3.5, 4, 4.5, or 5. A 5-star rating is very, very difficult to get. So, working with a 3-star rated plan or a 3.5-star rated plan can still be a very good plan. Sometimes people hear that rating and they're like, oh gosh, that doesn't sound very good. But if you consider just how difficult a 5-star rating is, and look at 4-star ratings as being truly excellent, 3.5 to 3 is still a very good plan. Now, the way that they get these ratings is a lot of different ways. They compare the doctor's networks, the price of the plan, the price of the copays, and of course, customer satisfaction. Medicare takes a lot of feedback, complaints from folks that enroll into these types of plans, and all of that information goes into them making their designations each year of how many stars a plan will be. If a plan is new, of course, it will not have a star rating. And we do sometimes sell plans that do not have a star rating, but it may be that it's, a plan from a carrier like Humana or Aetna that we deal with a lot. So they may offer a new plan in an area or branch out into a new area and be offering plans for the first time. These plans aren't going to be rated. Doesn't necessarily mean that you shouldn't buy into them. Aetna and Medicare, or Aetna and Humana have some very good Medicare Advantage plans. It just means that there's no rating at this point because there hasn't been enough time to collect information on those types of um, you know, customer satisfaction costs and such. Oops. All right. So when we talk about Advantage plans, primarily we're going to be talking about HMO and PPO style network options. So I want to make sure that you're aware of the difference of these network options. First, we'll start with HMO. So HMO stands for Health Maintenance Organization. These types of plans generally require that you have a designated primary care physician, and you will typically have to go to your primary care physician or um, at least contact your primary care physician to get referrals to see specialists. HMOs require that you follow the rules of their network in order to ensure you have coverage. And that means staying within the provided network. Um, so if you go outside of the network, you may be faced with paying 100% of the cost. Um, Now they're going to cover any emergencies or urgent care services out of network because obviously they're very emergent or need to be taken care of even if you're not in network. And they'll also cover out of area renal dialysis if have permanent kidney failure, end stage renal disease, and need dialysis while you're traveling. But in general, routine care is going to need to be within the HMO's network in order for it to be covered. So that's important. Now, in exchange for that, you may have lower costs for your copays and possibly some other benefits that may make it worth it to have that stricter network coverage. The other side, HMO, or excuse me, the other side to the HMOs is PPO, which stands for Preferred Provider Organization. Now, these are generally networks that are more flexible. They're going to allow you to go to a doctor or hospital that accepts Medicare, but may not necessarily be in the network. You typically will pay a higher copay or price if you go outside of the network, but you do have that flexibility. You typically are not required to see a primary care physician to get referrals to specialists when you have a PPO, but you may have higher premiums or higher copays because of the greater flexibility that these types of plans are affording you. So typically, people who spend a lot of time out of their home area or travelers, snowbirds like we have here in Florida, PPOs can be a good option for them. So one thing that we are seeing more and more, even with the HMO plans, are travel benefits, which will allow you to use a national network of providers and still be considered in network. If you're considering Advantage plans, definitely ask your agent, does this plan offer any kind of a travel benefit? And they can explain exactly how that's being offered within a particular plan. All right. So the big question we get, how do you decide which type of plan is going to be best for you for your Medicare? So what I tell people is to look at certain aspects of your lifestyle. You travel a lot. When you do you travel for long periods of time outside of your home network? Are your particular doctors that you see important to you? Um, in general, network style plans, um, we will try to determine before you enroll whether or not your doctor is in the network, but that may not be that important to you. The coverages may be more important. We also look at how a plan will cover your prescriptions. What are your costs going to be when you go to this pharmacy versus that pharmacy? As agents, we're always trying to, with your permission, look at your medications, ask you which pharmacies you like to use, um, and we can go very clearly through each medication and what its cost will be to you using a particular plan, a particular pharmacy. And then we also look at, are you overall satisfied with the costs that are associated with the plan? With this supplement plan, you're paying upfront for a certain level of coverage. And you're not really paying much out of pocket as you use that coverage. Do you like to be covered that way, or would you rather, not pay a higher monthly premium and only pay out of pocket when you use it? If you're fairly healthy and you don't go to the doctors a whole lot, you may not want to be paying a premium of, $100+ for a supplement, because, an Advantage plan at $0 allows you to save that money. Um, so these are all questions that you work with an agent to answer to try to decide which is going to be best for you. We're not able to say, oh, you want this plan because of this, this, and that. We're giving you the facts, we're answering your questions, and hopefully giving you the tools that you need to make a decision. Okay. Um, Like I said, agents can assist you with all of this, but Medicare.gov has all of this information available on their website. I know it can be a little bit daunting to navigate it, but if you're, at all tech savvy, it is a nice process to be able to go through to see what your options are if you might be considering a drug plan or an Advantage plan. It's a nice tool. And it can do pretty much anything an agent can do as far as looking deeply at a particular plan. Now, if you find you can't get the information you're looking for, then absolutely, an agent's going to be your best bet. We're very familiar with looking at the summaries of all the benefits, going through that with folks to help them, get the answers that they're looking for and to make that best decision for them. All right. So just to summarize some of your choices. Um, First, deciding whether or not you even want to go on Medicare. You can always call an agent to compare your employer coverage and whether or not Medicare might be lower in cost or more comprehensive than what you have with your group coverage. We're always happy to do that. Remember, as long as you have your group coverage in place and it's considered credible coverage, you can delay your participation in Medicare as long as you're working and have that coverage there. If you drop your employer coverage and go on to Medicare, be advised that you may not be able to get back your employer coverage. That's something obviously you'd want to check with your employer about. But a lot of times, once you walk away from that coverage, when you're Medicare eligible, you may not be able to go back to it. If you do decide that you want to go on to Medicare, you can combine that with your group coverage if you choose to. You can have Part A and Part B in the group coverage. And between the two, they'll coordinate. One would pay primary, one would pay secondary, and how your employer plan is set up sort of determines that. Um, Most of your coverage, most of your medical needs would likely be covered. You may have some co-insurance to cover, but that's something that you can certainly look at with um, taking Medicare and maintaining your employer coverage. Now, it's important to remember that if you do take your Medicare in that way, your Part B has started, and you may not be able to use that open enrollment period later on to get into the supplement of your choice. So again, that's another good reason to give an agent like us a call to ask those questions, especially if you have any kind of ongoing medical concerns. And then if you did decide to stay, did decide to go on to Medicare with just Medicare Parts A and B, do you want to add on the standalone prescription drug plan or a Medigap plan to help you cover the costs that would come out of your pocket? Or do you would like to go with Plan C, the Medicare Advantage plan? As I said earlier, you can't have both a supplement and an Advantage plan at the same time, but you do have the option, stick with Medicare, add the secondary or supplement, or turn those benefits over to an HMO or PPO style Medicare Advantage plan. So that pretty much wraps up my presentation. My contact information here on the screen. I would encourage you, any questions, feel free to reach out to me. I'm 9 to 5 typically Eastern time, Monday through Friday. And if you're calling from a state that I'm not licensed in, I can get you to one of the agents that I work with to answer your questions.
If you have any questions, you can always utilize Deanna here and her contact information if it's anything general or social security information related to the Medicare questions too. You can contact the AMAC Foundation as well. We do have social security advisors that can help with some of those questions that overlap. Thank you very much for attending today.
Thanks, everyone.